There's a disturbing story about a trend called patient dumping that I have to share with you. What you're about to see here from CBS is how victims and patients are treated in the United States of America if they happen to not be wealthy.
So y'all just gonna leave this lady out here with no clothes on?
Overnight, Mamu Baraka was walking past a Baltimore hospital when he noticed something he says he'll never forget.
So I'm assuming that you all are with the security department? Okay. Is there a supervisor available?
The hospital's security guards had just wheeled a patient to a bus stop, and in the freezing temperatures, they left her there. The only thing she had on was a hospital gown.
It's about 30 degrees out here right now. Are you okay? Are you unable to speak? Are you okay, ma'am? Do you need me to call the police?
It's called patient dumping, and it doesn't just happen in Baltimore. In 2007, 60 Minutes investigated the practice of removing homeless patients from Los Angeles hospitals and leaving them downtown. Often the patients are not insured or have other financial issues. It's unclear if that was the case in Baltimore.
Go ahead and sit down. Okay, ma'am, go ahead and sit down. Thank you. I'm going to call to get you some help.
In a statement, the University of Maryland Medical Center said they share the shock and disappointment of many who have viewed the video. In the end, they say we clearly failed to fulfill our mission with this patient. The man who recorded the video called 911. He says medics ended up taking the patient back to the same hospital. A review is underway that could lead to personnel action against the hospital employees involved. Jeff
Pegues, thank you very much.
That's not what's needed. You don't need simply personnel action against the people involved. Somebody told them what to do. Somebody told those workers, this is what you're going to do. Now, you could say they should have objected. Perhaps you're right. But then they would have got fired. So the real problem is with the system. The real problem is with the chain of command. The real problem is with the higher-ups who said, this is what you're going to do. Because that decision was made by somebody who has authority. Why was that decision made? Dollars and cents. That's what it's about. We have a for-profit health system, health care system, health insurance system. For-profit. You know, under the law, you just have to be stabilized. Then they could kick your ass out. Okay, you were stabilized. We're going to kick you out now. Sure, it's 30 degrees outside and you have no clothes on and you're wearing a gown that's paper thin. We don't care. Get out of here. This is what happens when you don't have money in the United States of America. This is how you're treated. Is there anybody who could look at that and go, yeah, this is a good system. System's working just fine. And then you have people who have the nerve to say we have the best healthcare system in the world. That's just factually not true. The World Health Organization ranked us 37th. The Commonwealth Fund, when that study was done just a year or two ago, says that we have the worst healthcare system in the developed world. Shocker, every system in front of us is a single-payer system. So in other words, you pay taxes, your tax money goes to healthcare. So you don't run into a situation like this where they go, okay, are you breathing on your own? Great, let's kick them out. They don't do that because they don't have to worry about profit because it's not for profit. It's health. This is unconscionable, man. It's grotesque, it's immoral, and also it's embarrassing. How do you think the world looks at us when they see something like this? They go, wow, that's how you treat people? That's what you do. Can you imagine? She could have died. That woman could have died. She's probably drugged up. They gave her drugs for whatever issue she was dealing with. They didn't put her in clothes, kicked her out in her gown. 30 degrees outside, like that guy said. Thank God for that guy, that good Samaritan. She could have died. She would have wandered to a fucking alley somewhere, collapsed, and died, and then you wouldn't have even heard about it. It would have been in the local paper or something. By the way, they ended up bringing her back there. This guy, I called the cops or something. They showed up, figured out what was going on, brought her back there. Like, what are you doing? And this isn't, what everyone needs to understand, this isn't a one-off. This isn't like, oh, it just happened once or a handful of times. It happens all the time. This is patient dumping. It happens all the time. This is a particular egregious example because it's 30 fucking degrees out and she's wearing her gown and not clothes, but sometimes they'll get you dressed and they'll say, yeah, you're stabilized, be gone. This is how we treat the most vulnerable among us, man. Our fight is nowhere near done. Today's Martin Luther King Day. People are, talking about Martin Luther King's legacy. One of the things he said was inequality in the healthcare system is the worst form of injustice. Is his work done? No, it's not done. It didn't end with the Voting Rights Act and the Civil Rights Act. We got so many battles to still fight and win. I mean, this is sick to look at that. We have millions, tens of millions of uninsured people in the U.S. Hundreds of thousands of medical bankruptcies. Medical bankruptcies don't exist in other modern nations. We have 45,000 people that die every year because they don't have access to basic health care. These numbers are beyond terrible. And remember, we pay about double for our health care what other countries pay for theirs. So they cover half, they pay half what we pay, and they cover everybody. And they don't have medical bankruptcies, and they don't have people kicked out onto the street just when they're barely stabilized. This is an indictment on the system. It's not just the workers. This is an indictment on the system. We need a Medicare for all system. We need it now. And we need to come up with rules and regulations that work into the system, basic humanity, because we certainly don't have it now.